Hello, everyone. Happy evening. A very good evening. I hope and I believe all of you are doing well. Quick nod whether the audio visual is all good. Give me a minute so that I can see the audio visual. I'm not able to see that. Yes, I hope I'm audible and visible. Happy evening, everyone. Welcome to today's YouTube live class session where we are going to discuss the Fast 5 MCQs, clinical MCQs in microbiology. And if I may rename it, this is specifically the Fast 5 clinical MCQs. Even in microbiology, it is bacteriology that we are going to test in the today's Fast 5 MCQs. Some very, very important MCQs that we have. Okay, mildly unique, good observation. So I had a hairdo today, so I think that is what might be showing up. All right. So fast 5 clinical MCQs, the plan for the rest of the day. Also, we are going to meet again at 9 p.m. today on the Unacademy app for a free live class, which is a live quiz. It's KBMD, that is Kaun Banega MD, top 10 mnemonics. Okay. Top 10 mnemonics, like we have the KBMD, that is what we have at 9 p.m. today. Right. Yes, Neha, I did. And the plan for tomorrow, that is 29th, is tomorrow 8 a.m. we will have a YouTube live class where it would be the mixed bag, most expected MCQs that we have for FMGE and NEET PG. And at 12 p.m. we will have the next mnemonics crash course. Right, we have the next mnemonics crash course, and we are going to discuss the volatile stuff in surgery, the classification scores, the name surgeries, and all of that. Okay. Yes. I think, yes, you all have good observation. Good achievements. I'm so sorry for not being able to post a PDF. I'll do that after the YouTube session today. Seems less likely that the NEET PG is going to be postponed. I had mentioned initially as well that I don't want any one of you to regret later that if the exam is not postponed, we did not study hoping and considering that the exam will be postponed. But seems like it's less likely. So at least now let's, get to the higher gears, like increase our speed, increase our pace, and do more in the limited time that we have. See, whatever time you have got is the same time that everybody else has got. It's not like you've got less or anybody has got more. It's the same amount of time that everybody is getting. All right. Okay. All right, let's start with the questions. We have to meet again at 9 p.m. Right, for the KBMD, very, very interesting top 10 mnemonics mixed bag. And tomorrow we'll be meeting at 8 a.m. and at 12 p.m. Okay, so that's the plan for tomorrow. Okay, hello. Batao, this is the first question here. What do you think is the answer to this question? Okay, so I think a lot of confusion is what I see in the answers here, but majority of you have got that right. And some of you are confused as well, it seems. The correct answer here is D. That means it requires iron and cysteine for growth. Iron and cysteine for growth. So why is that the answer? Because you have that the organisms grew on buffered charcoal yeast extract agar. That is enough to help you make a diagnosis here. So buffered charcoal yeast extract, that is BCYE. I hope I hope all of you have seen the mnemonics on culture media, where we have discussed ki BC, ye, le, right? It was our fun mnemonic that we had. If anybody talks anything else about note bandi, right? Everybody was so frustrated then कि बोल दिया किसी को BC ये ले, एक और गोली मार दी अगर किसी ने कुछ और बोला. So that is BC ये ले. That means BCYE is le is basically for Legionella, to avoid the confusion that this is not for Listeria. This is for Legionella. So buffered charcoal yeast extract agar tells you that this is Legionella. And for Legionella, the correct out of this is it requires iron and cysteine for growth. What organisms basically require cysteine? Remember, cysteine is like sisters. Okay, cysteine is like sisters. So all the Ella wale sisters like Legionella, Francisella, Pastorella, all of that basically need cysteine. Remember, the Ella sisters require cysteine for growth. Okay. Culture media is there on the YouTube, and part 2 on the special class. We have taken it in NF100 also. You'll get the link in that NF100 wala list. Okay. So Legionella pneumonia capsule is what, like related to pneumonia, the capsule would be your Streptococcus pneumoniae. No cell wall. Which bacteria has no cell wall? It is your Mycoplasma, right? Mycoplasma has no cell wall. That is why your antimicrobials acting on the cell wall synthesis inhibitors, they are not effective against Mycoplasma. So your beta lactams, right? Beta asking for cycle, bus, van, Ford, all of these will not be active against Mycoplasma. What else have we seen for Mycoplasma? Myco eats egg in the dinner, right? That is what we had seen. So it is called as eat-on agent. It has fried egg appearance. Dinner is your Dine's method of staining is used, right? Dine's method of staining is used. Which bacteria is optochin sensitive? Which bacteria is optochin sensitive? Optochin, staying near the chin, that is resistant. Your oral wala Streptococcus viridans mutans, that is resistant. Streptococcus pneumoniae is the one which is optochin sensitive. Pneumoniae P and P, it is optochin sensitive. Okay. So remember, this is your requires iron and cysteine for growth. And for Legionella pneumonia, okay. Just give me a minute. Right. For Legionella, what do we have for Legionella? Legionella, remember NELA, that's basically your sodium low as well. Hyponatremia is an important finding in Legionella pneumonia. The patient has headache, and along with pneumonia, the patient can have diarrhea, headache, confusion because of hyponatremia. All those are features seen with Legionella, right? There will be the history of air conditioner, right? Someone on a cruise, those history would be there. Okay, those history would be there. So this is about the question number 1. Let's go to the next question. What do you think will be the answer to this? We have discussed quite a few times this question in KBMDs. Very good. Vedusha has answered it correct. Almost all of you are getting it right. Absolutely right. The answer here is arthropod vector. The patient likely acquired the infection via which of the following routes? That is arthropod vector. What is the diagnosis? This is a man who presents with fever, facial palsy, very, very important, headache and malaise. There's a history of circular rash. Okay, circular rash. The patient was unaware of that. So when you have circular rash with facial palsy, right, with fever and all, the first thing that comes to the mind is Lyme's disease, right? That is the Lyme's disease. Lyme's disease basically caused by Borrelia burgdorferi. Okay, it is caused by Borrelia burgdorferi. It is caused by ticks, right? The hard tick. And what's the mnemonic for Lyme's? Remember, it is face. Face is the mnemonic. We use the lime, the lemon face wash. So remember, face is for limes. F is for facial palsy. It could be bilateral. Neurological one is generally unilateral. This is bilateral. A for arthritis, arthralgia. C for cardiac involvement. There can be AV blocks. And E for your erythema, right? You have your target rash. Okay, you have the target rash that is seen, the bull's eye or the target rash is seen with Lyme's disease. You get image based question also on this, right? You get image based question. Erythema migrans is what is seen, and E is also for encephalitis. Okay, E for encephalitis. So the answer here is arthropod vector, that is basically ticks. Okay, it is the tick which causes your the Lyme's disease, Borrelia burgdorferi. Facial palsy, it's a very, very important clue. Sometimes you'll be given the history of arthritis, cardiac involvement. That is why we should know all of that. Okay, we should know all of this. Very, very important. Okay. Going to the next question, question number 3. What do you think is answer to this one? Okay, so I see the mixed answers here. Someone saying C, some saying B, some saying E. Majority of you say B, I see. Bile solubility. Some of you say C as well. All right. So I see here that what is leading to the confusion. Bile solubility. Why bile solubility? Bile solubility is a characteristic of, I don't see anybody getting it right so far. Someone had got it right. Divya has got it right. The correct answer here is coagulase production. The correct answer here is coagulase production. Why? Now, bile solubility, many of you answered bile solubility. Bile solubility is a feature of Streptococcus pneumoniae. How did we remember that? Pneumonia is in the lungs. It's not in the intestine. So it will not be able to tolerate bile. It will get dissolved in bile, right? So bile solubility is a feature of Streptococcus pneumoniae. Bacitracin sensitivity. Bacitracin sensitivity, B for B. It is used for your beta hemolytic streptococci. What is the mnemonic? It is B brass, right? It's your B brass. Bacitracin, your group B streptococcus is resistant. Group A is sensitive. Which is group A and which is group B? Your streptococcus pyogenes is your group A. Group B streptococcus basically is your streptococcus agalacti, right? Your campo positive neonatal meningitis, all of that. So bacitracin, catalase production is the test. Staphy is a cat. Remember, Staphy is a name of a cat. So Staphy, Staphylococcus is catalase positive. Streptococcus is catalase negative. Coagulase is the test which is done specifically for identifying Staph aureus, right? It is done for Staph aureus. If you want to differentiate Staph aureus from the rest, Staph epidermidis, all of that saprophyticus, then coagulase is the one. Optochin sensitive, again, that is your Streptococcus pneumoniae, which is optochin sensitive. So now you know these are the organisms. Look at the condition which is given. There is diffuse epidermal peeling, there is erythema, And you see that the organism is a gram-positive, which is highly salt-resistant. Do you remember the culture media for Staffy cat? Right, we had seen the cat drinking milk with the salt in it. So you have milk salt wala agar, mannitol salt agar. So basically salt is helpful for the growth of staphylococcus. Okay, salt is helpful for the growth of staphylococcus. So this is basically your, the diagnosis here is staphylococcal scalded skin syndrome. Right, it's your staphylococcal scalded skin syndrome. It is Staph aureus, and for Staph aureus, the most specific test is your coagulase production, right? The coagulase production. That is why this is the answer here. I hope everybody is clear. So I think many of you got trapped here in this question, right? So read the question very, very carefully. Okay, read the question very carefully. All right, let's go to the next question now. Again, a very, very important question. Very good. Dr. House has answered it. Niranji has answered it. The correct answer here is poultry. The correct answer here, the original contamination probably was found in poultry, because basically this is a reservoir for your Campylobacter jejuni. Very, very important. Campylobacter, you'll be tested many times on this concept, that it grows at 42 degrees centigrade. It is microaerophilic. Its gram-negative curved rod polar flagella are seen in pairs. That is, your seagull appearance is seen. Very, very important. Remember, Campylobacter is a curved organism, 42 degrees centigrade, microaerophilic. What culture media are used for Campylobacter? Remember camp. Who goes on a camp? A butchard. That's a butchler medium. He goes on the camp, and what happens? He wants to kill the sparrow. That is your sparrows. Sparrow is the sparrow's medium. But suddenly he gets a paralysis attack. That is CVA, cerebrovascular accident. And Campy is your Campylobacter medium, right? So all these are the media for Campylobacter. Campylobacter, Butchler, sparrows, and CVA medium. This is from our culture media mnemonics, right? 42 degrees centigrade, microaerophilic, very, very important, Campylobacter, which is also responsible. It has an association with GBS, Guillain-Barré syndrome. It has an association with that. Poultry is the reservoir, right? Poultry is the reservoir. Improperly, the canned food. Canned food is the bottled food. Bottled food is your botulism. Okay, that's the history for botulism. Fried rice, remember, is your Bacillus cereus. Cereus is like Chinese rice. That's your fried rice. Reus is like rice. That is your fried rice is Bacillus cereus. Okay, that's your Bacillus cereus. So that was the question number 4. I think, yes, this is the last question. What do you think would be answer to this one? All the questions that we are discussing today, all of these are very, very important and like must know. Be it for your NEET PG, AIIMS or FMGE exam. I'm hiding this option D. The option D is basically here what's sensitive. It is optochin sensitive. Okay, this one is optochin sensitive. What's the answer to this? Absolutely right. The answer here is basically A. That is your gram-negative coccus capsule and ferments maltose and ferments maltose. What is the history here? This is a dormant, right? Dormitory में रहने वाला. Then you have petechial rash, headache, nuchal rigidity. Whenever you have these signs of meningitis, headache, vomiting, neck rigidity with petechial rash. The diagnosis is Waterhouse-Friderichsen syndrome, right? Very, very important. Waterhouse-Friderichsen syndrome, which is caused by Neisseria meningitidis. It is Neisseria meningitidis, that is your meningococcus. Which is N, it is gram-negative coccus, right? It has a capsule. And remember, meningitis is the one, M for M. It ferments your maltose. That is the history. Gram-negative coccus ferments glucose only, G for G. It is gonorrhea, right? It is your gonococcus, glucose. Gram-negative coccobacillus capsular serotype B. That is basically your HIB, Haemophilus influenza subtype B. Gram-positive coccus, alpha hemolytic optochin sensitive. Again, optochin is your streptococcus pneumoniae, which is optochin sensitive. What is this option here? Gram-positive rods which grows at 4 degrees centigrade. What does the option E indicate? Gram-positive rods which grows at 4 degrees centigrade. That is listeria. Okay, that is listeria. Right, listeria has differential motility, tumbling motility, and the medium used is pulcrum. It forms your rocket tails, actin polymerization. All that is important. Listeria also responsible for amnionitis, premature rupture of membranes, meningitis. All those are important, right? The neonatal, newborn meningitis, listeria is an important cause. So it has tumbling motility. So yes, the answer here is A. Okay, the answer here is A. So let's quickly revise the 5 questions that we have seen, the concept today. BCYE is your Legionella, right? And Legionella, all the Ella sisters require cysteine for growth. Next one, facial palsy rash, always thinks of Lyme's disease, and it is your tick. It is arthropod vector. There would be history of patient going to a hilly region, right, hiking history, all that would be there. Erythema, diffuse epidermal peeling, gram-positive, salt-resistant, Staphylococcus aureus. Aureus is your coagulase positive. That's the specific test for Staph aureus. Curved rod, microaerophilic, 42 degrees centigrade, Campylobacter. It's your poultry, right? Campylobacter is poultry. And the next one, meningitis with petechial rash. It's your Waterhouse-Friderichsen syndrome. Neisseria meningitidis, which ferments maltose. Okay, which ferments maltose. So that's the answer there. So those were the fast 5 for clinical MCQs in microbiology today. I hope these, few MCQs every single day will help you keep, develop the practice of solving the MCQs like that, which are very, very much expected in your exam, right? These type of questions are very much expected in your exam. We'll keep doing it often. Okay, so what's the plan now? We'll be meeting again, right? We'll be meeting at 9 p.m. Unacademy app, free live class, that is KBMD, Kaun Banega MD, on top 10 mnemonics, mixed bag mnemonics. It's a free live class. You can join. The link is in the Telegram group. And if you are asked for the code, you can use the code Dr. Nikita. Okay, you can use the code Dr. Nikita. Thank you so much, everyone, for joining in. And we'll keep doing more sessions like this. If all of you have enjoyed it, give me a quick thumbs up so that I know that, all of you have enjoyed it and you would like to have more sessions like this in the coming days before your exam. All right. See you at 9 p.m. in next 1 hour on the Unacademy app. Till then, goodbye. Take care and keep studying, keep revising, and keep winning. Thank you so much.